PowerPoint presentation on a psychobiological disorder. Anxiety disorders. Definition: anxiety can be defined as a feeling of apprehension, uneasiness, uncertainty, or dread resulting from a real or perceived threat. I will be discussing about generalized anxiety disorder. It is defined as an anxiety reaction characterized by persistent and exaggerated apprehension and tension. Worry is the major concern in GAD. The contributing factors are, like most mental health problems, GAD appear to be caused by a combination of biological factors, psychological factors, and challenging life experiences, including stressful or traumatic life event, family history of anxiety disorders, childhood development issues, alcohol, medications, or illegal substance use, and other medical or psychiatric problems. The brain mechanism behind GAD is the first one is the neurotransmitters altering amygdala volume. Neurotransmitters in the brain and other hormones modulate the neural circuitry involved in anxiety. Elevation of amygdala activity or limbic hyperactivity results from neurotransmission dysregulation caused either by the suppression of inhibitory neurotransmission, increased ex- excited um, increased excitatory neurotransmission, the combination of both the above processes, the increased secretion of monoamine neurotransmitters like serotonin or norepinephrine, which raises blood pressure through vasoconstriction, excessive reactivity to opioid peptide, and neuropeptide activity in amygdala based neural circuits. In several studies, the dysregulation of GABA or gamma aminobutyric acid, a inhibitory neurotransmitter, especially the GABA A variant, has long been found to elevate the amygdala activity in the brain, thereby causing GAD. The next one is the VLPFC or ventrolateral prefrontal cortex. Apart from the aberrant functioning of the VLPFC, the relationship between the prefrontal region and the amygdala, when altered, also results in symptoms of GAD. The main activity of VLPFC is inhibition. As you can see, this one is the VLPFC. When a patient is subjected to relentless cognition, VLPFC inhibition is decreased, thereby modifying the effects of amygdala volume. Studies have hypothesized that the nervous dysregulation affecting the synergy of the VLPFC amygdala connections might cause anxiety. It is found that in GAD patients, there is a weaker pairing between the VLPFC and the amygdala. Sometimes decreased or increased connection between other prefrontal cortexes with the amygdala also results in GAD. The next one is the hippocampus alteration. This part is the hippocampus part. Processing of long-term memory is a vital role of the hippocampus. An increased level of amygdala activation indirectly causes the secretion of stress hormones, which directly interacts with the hippocampus. Researchers have discovered that continuous exposure of an individual to stress hormones adversely affects the development of nerve cells in the hippocampus region of the brain. This aspect may be responsible for the memory dysfunction in GAD patients. The next one is the autonomic dysfunction. The major autonomic dysfunction in GAD patient is the inability to alter the heart rate as a result of reduction in heart rate variance. The change in concentration of white matter present in the DLPFC or dorsolateral prefrontal cortex, this part, region of brain, is responsible for HRV. The changes seen in heart rate variance in both the regions may be due to extensive interaction with blood oxygenated level dependent signal change during anxious condition. My patient name is John Carter. He's 40 years old male. He's Canadian and lives in Regina, lives in an apartment, and he's been diagnosed as generalized anxiety disorder. His medical history, he has the complaints of restlessness accompanied with difficulty in concentration on a single task. He cannot sleep for more than 2 hours at a time and keeps on waking up at night, which makes him look tired. And his relationship with his wife is not as before due to all the symptoms. He is worried and irritated. All these symptoms are there for 7 months when financial troubles were started. His worry increased a lot recently, sorry, resulting in headache and chest pain. Thus, he came to the hospital for further treatment and checkup. Other comorbidities are the hypothyroidism and heart disease. And he's having lacking social support and not in a good relationship with friends and other family members. Moving to the nursing process, first part is the assessment. In the subjective data, my patient said that I am worried, and I saw that he was having lack of concentration. My question was, what concerns would you like to talk about? The therapeutic communication skills that I used is the giving patient the opening. The second assessment in nursing process, the subjective data is I cannot sleep for 2 hours at a time, my patient said. Objective data, he appeared tired. My question was, you look tired. Have you had enough sleep last night? The therapeutic communication skill used was making observation. The next part in nursing process is nursing diagnosis. First nursing diagnosis according to NANDA is anxiety related to family issues. And the second one is disturbed sleep pattern related to increased worry secondary to stress. The treatment goal is teach relaxation technique to reduce anxiety. And the second one is increase quality and quantity of sleep. The third part in nursing process is the intervention. The first intervention is I taught the relaxation exercises like yoga and meditation. I also made an appointment for CBT. The second one is health education given on no late afternoon smoking or alcohol drinking. And next one is the decreased screen time in the afternoon. The evaluation, sleeping for a longer period of time, and the worry become less with guided medication and talking to his wife. Next, the doctor prescribed tablet alprazolam 0.5 mg orally 3 times a day for 10 days. For this medication, there were some teaching that I gave to the patient. Though there are, there might, though it might be rare, but some people may have had very bad and sometimes deadly side effects when taking a drug. You should tell your doctor or you should get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. The signs and symptoms are signs of an allergic reaction, signs of depression, shortness of breath, then suicidal thoughts, emotional ups and downs, abnormal thinking, lack of interest in life. Next, shortness of breath, very bad dizziness or passing out, feeling confused, memory problems or memory loss, trouble speaking, trouble passing urine, trouble controlling body movements, muscle twitching, a fast heartbeat, blurred eyesight, or period or menstrual changes. I also gave some community support resources to my patient. The first one was the counseling services in Regina by the Level and Associates. The second one is the social work registry by the Saskatchewan Association of Social Workers. And the third one is the Celebrate Recovery by Salvation Army, the Regina Heaven of Hope Ministries. These are all located in Regina, and I also gave the phone number of these places. I also gave some crisis intervention resources to my patient. The first one was the crisis services by Mobile Crisis Services Regina. It is a 24/7 hotline number. The second one is the Emergency and Crisis Assistance by the University of Regina. I also gave the phone number of this place. Thank you.